Hi, my name's Claire Vernon. I'm the Chief Executive Officer at JewishCare, a not-for-profit organisation. JewishCare started in 1936 as a refugee support agency to assist Jewish people escaping Nazi Germany. We continued through the 1940s, where Australia became a destination for many Holocaust survivors. We have continued to evolve and grow and are now the major community service provider for the Jewish community in New South Wales. JewishCare provides a range of services responding to contemporary needs in the community. We provide aged care, so supporting many people to live independently at home, including a number of Holocaust survivors where we receive specific funding from the Claims Conference. We support people with an intellectual disability, running employment programs and other activities. We support people living with a mental illness to give them community connection, casework support, and we also run a child and family team, so we ensure that any crises or concerns with youth, young people and families, we're able to respond to. With a staff of 300 and over 500 volunteers, we are uniquely placed to provide professional support to the community. COVID-19 presented all our organisations across Australia with a unique challenge around supporting the most vulnerable living at home while keeping our staff safe. Here at JewishCare, we continue to deliver services to the elderly at home, to people with disability. We ramped up our mental health program because there were many people who were very anxious and concerned about what was happening. We did cease a lot of our day programs. We run 4 houses for people with intellectual disability, and we knew that that was a particular area of concern for us. So we took lots of measures to try and keep everybody safe. Having said that, we then put in place a whole lot of Zoom, remote connecting programs so that people would feel less socially isolated and stay socially connected while physically distant. One of the unique things about a community organisation is we can respond to an issue such as suicide in a very unique way. So a couple of years ago, we put together the Jewish Suicide Prevention Strategy, where we brought together the Jewish day schools, the rabbis, the synagogues, sporting clubs and others to try and put in place a strategy where there was increased awareness about mental health in the community and some of the signs that somebody may be considering suicide. We run mental health first aid training. We've trained hundreds and hundreds of community members to be more aware and more skilled at responding. We've put in place, with the support of health services, an aftercare program so that following a suicide attempt, people are getting intensive support, and a whole range of community awareness raising so that people feel comfortable to come forward and seek help. One of our major areas is supporting people to age at home, because we know that people would prefer to remain at home for as long as possible. One of the things which people are often find difficult is planning for that. So we have a team of social workers who work with families to support them through decision making. There may be a family member who's been diagnosed with dementia, there may be increasing frailty, where people are living may no longer be good for them, and often that decision-making process takes time. And we try and avoid the decisions being made at following a hospitalisation, which is often when those decisions have to be made. So we work with general practitioners and the community to refer people to us early and perhaps put some plans in place for when they're needing increased support at home. We also know that social isolation can be very challenging for the elderly. So we have in place a lot of social outreach programs, friendship clubs to keep people connected. That also means that as they age, they're more likely to come to us when they do need that extra assistance at home. Office here based at Bondi Junction. We also have an office at St Ives. People are very welcome to just come in, and we have a lot of people who see us as a community hub to come and talk to somebody. We have an intake officer, and every day she's taking calls from people who are worried about ageing parents, youth, anybody in their family that they're concerned about. We get a lot of phone calls from general practitioners. We work very closely with the local hospitals, with Headspace, and we're often giving talks to other organisations about working within the Jewish community, supporting Holocaust survivors. So we have a strong reputation for professional support and are very linked in with the health services in the area.